Hello everyone. Today we shall learn about the different diseases of the eye. Now we have divided them into various groups based on the conditions of the various parts of the eye. So let us begin with the conditions of the eyeball. These are the refractive errors of the eye: myopia and hyperopia. Myopia, also known as nearsightedness or short-sightedness, is a common vision condition where distant objects appear blurry while close objects are seen clearly. This occurs because the eye focuses light in front of the retina instead of directly on it due to the shape of the eye or cornea. So it is a form of refractive error, as you can see this picture. A myopic eye means that the light is focused in front of the retina, not on the retina itself, in front of the retina, as a result of which an individual has nearsightedness. Hyperopia, also known as farsightedness, is a common vision condition where distant objects are usually seen more clearly than nearby objects. This happens because the eye doesn't bend light correctly, causing it to focus behind the retina instead of directly on it. So it is also another refractive error. This is the picture of myopia. Here you see the light in a normal vision is focused on the retina, but in case of myopia, it is focused in front of the retina. This is hyperopia, where the normal unlike the normal vision, the light is focused behind the retina instead of being focused on the retina itself. Okay. Now, there is one more condition which is called presbyopia. It is important to note that hyperopia is different from presbyopia, which is an age-related farsightedness, and it is a natural part of aging where the lens loses its flexibility and ability to focus on close objects. Now we come to the conditions of the cornea, iris, and lens. Now we look at astigmatism. Astigmatism is a common vision condition where the eye's cornea or lens has an irregular shape, causing blurred or distorted vision at all distances. This irregular shape prevents light from focusing properly on the retina, leading to blurred vision. As you can see in the diagram, the focus is not very proper, or it is that causes blurred vision. Now, aniridia, which is a Greek term for without iris. We had learnt in the parts of the eye what is an iris. So, aniridia is a rare congenital condition. Congenital means people are born with it, characterized by the underdevelopment of the eye's iris. This usually occurs in both eyes. It is associated with poor development of the retina at the back of the eye, preventing normal vision development. Aniridia is a rare congenital eye condition causing incomplete formation of the iris. Here, the iris is not fully formed. This can cause loss of vision, usually affecting both eyes. In aniridia, although not entirely absent, all that remains of the iris, the colored part of the eye that is a thick collar of tissue around its outer edge. The muscles that open and close the pupils are entirely missing. The appearance of a black iris is the result of the really enormous pupil. Now, cataract, or pearl eye. Cataract derives from the Latin name cataracta, meaning waterfall, and uh, the Greek name that is cataractes, okay, meaning to dash down. Early Persian physicians called the term nazul or descent of the water. It was believed that such blindness was caused by an outpouring of uh, the corrupt humor into the eye. But actually, this is called pearl eye in English, as uh, cataract is basically a clouding that develops in the crystalline lens of the eye or in its envelope, varying in degree from sight from slight to complete opacity and obstructing the passage of light. Early in the development of age-related cataract, the power of the lens may be increased, causing nearsightedness, and the gradual yellowing and opacification, that is becoming opaque, of the lens may reduce the perception of the blue colors. Cataract typically progresses slowly to cause vision loss and is potentially blinding if left untreated. The senile cataract occurs with age, and moreover, with time, the cataract cortex liquefies to form a milky white fluid, and which can cause severe inflammation if the lens capsule ruptures and leaks. Now, keratitis. This is an inflammation of the cornea, the transparent membrane that causes or covers the colored part of the eye, that is the iris, and the pupil of the eye. Symptoms of keratitis include uh, having tears, pain, sensitivity to light, inflammation of the eyelid, decrease in vision, and redness. It can be caused by bacterial, viral, or fungal infections. Dry eyes resulting from disorders of the eyelid or diminished ability to form tears, exposure to bright light, foreign objects that injure or become lodged in the eye, sensitivity or allergic reactions to dust, pollen, pollution, and other irritants, vitamin A deficiency, and of course, maybe the causes. Now, coloboma. This is a gap in part of the structures of the eye. This gap can be large or small and is normally in the bottom part of the eye. It is caused when a baby's eyes are not developed properly during pregnancy. The eyes usually develop between the fourth and anything up to the 15th week of pregnancy. So, though the development is usually completed around 8 weeks, and coloboma can affect a number of different parts of the eye. It does not mean that there is a hole in the eye, but that certain structures or parts within the eye did not form fully. It can affect the iris, it can affect the lens. Okay, coloboma can also affect the choroid, and finally, and also the retina. Very rarely, coloboma can also affect the optic disc or the eyelid. A coloboma forms whilst the baby grows in the womb. The eyes develop, and the eyes, while the eyes are gradually developing during pregnancy. Okay, so this is what is coloboma. Now we move on to trachoma. Trachoma is a result of the infection of the eye uh, with chlamydia trachomatis, infection spreads from person to person and is frequently passed from child to child and from child to mother, especially where there are shortages of water, and there are a lot of flies and there are crowded living conditions. Infection often begins during infancy or childhood and can become chronic. If left untreated, the infection eventually causes the eyelid to turn inward, which in turn causes the eyelashes to rub on the eyeball. As you can see, if the eyelid turns inward, the eyelashes rub on the eyeball, resulting in intense pain and scarring of the front of the eye, ultimately leading to irreversible blindness, typically between 30 and 40 years of age. Now we come to presbyopia. If you remember, I had referred to it in the beginning. Presbyopia is the defect of vision due to which an old person cannot see the nearby objects clearly due to the loss of power of accommodation of the eye. It is caused by the gradual weakening of the ciliary muscles and diminishing flexibility of eye lens. It can be corrected by using convex lenses. Now we move on to the conditions of the retina. Retinoblastoma is a cancer of the retina. It is usually caused in children. It originates from the retina, which is the light sensitive layer in the eye, and it is the commonest eye tumor which is caused in childhood. If untreated, retinoblastoma is almost always fatal, hence the importance of the diagnosis and the treatment. As a child does not complain of any poor vision, the tumor may seem undetected. The most common way of presentation is a white reflex or leukocoria behind the pupil. This is sometimes called the cat's eye reflex. There may be other causes of this white reflex as well, but an evaluation uh, by an ophthalmologist is a must in the children to rule out the possibility of this life-threatening disease. It may also present as squint or cross-eye, poor vision, painful red eye, inflammation of the eye, surrounding eye, protrusion, um, inflammation of the tissue surrounding the eye, protrusion of the eyeball, etc. Occasionally, it is detected on a routine eye checkup by an ophthalmologist, especially in a child with a family history of this disease. Diabetic retinopathy is a complication of diabetes that results from damage to the blood vessels of the light sensitive tissue at the back of the eye, that is the retina. At first, diabetic retinopathy may cause no symptoms or only mild vision problems. Eventually, however, diabetic retinopathy can result in blindness. Diabetic retinopathy can happen to anyone who has type 1 or type 2 diabetes. Macular degeneration. This is a disorder that includes a variety of eye diseases that affect central vision. Central vision is what we see directly in front of us rather than what we see in the periphery or the side of our vision. Macular degeneration is caused when part of the retina deteriorates. The retina is the interior layer of the eye, if you remember. The macula is the central portion of the retina and is responsible for detailed vision. Age related macular degeneration is the most common type of macular degeneration And there can be two types of age-related macular degeneration, that is dry or atrophic form, and wet or neurovascular form. Retinitis pigmentosa is one of a group of inherited visual disorders that causes the degeneration of the retina of the eyes. Vision gradually decreases and may eventually be lost. Retinitis pigmentosa can be associated with deafness and other malfunctions, central nervous system and metabolic disorders, and chromosomal abnormalities. Most cases of retinitis pigmentosa take a long time to develop and vision loss is gradual. Signs usually appear during childhood or adolescence, beginning with night blindness, followed by a slow loss of peripheral vision. Vision means sidewise, what you see on your sides, okay? The periphery, not the center. The disease will cause further loss of sight vision, and eventually, people with retinitis pigmentosa may hit against or bump into objects around them as their vision becomes limited to one direction. They can only see straight ahead as if in a tunnel, which gives the disease its common term, that is tunnel vision. Tunnel vision is a loss of peripheral vision with retention of central vision, resulting in a constricted circular tunnel like field of vision. It can be caused by blood loss, alcohol consumption, retinitis pigmentosa, hallucinogenic drugs, glaucoma, panic attack, intense physical fight, severe cataracts, etc. Sometimes the disease is genetically dominant, meaning that only one gene needs to come from a parent for a child to have retinitis pigmentosa. Now we move on to retrolental fibroplasia, which is now known as retinopathy of prematurity, ROP in short. This is an eye disease that primarily affects premature infants. It occurs due to abnormal blood vessel growth in the retina, the light sensitive tissue at the back of the eye. Okay. This abnormal growth can lead to scarring and retinal detachment, potentially causing vision loss. ROP is strongly associated with premature birth and the use of oxygen therapy in neonatal intensive care units. In premature infants, the retinal blood vessels may not be fully developed. Oxygen therapy, while necessary to support breathing, can sometimes interfere with this development, leading to abnormal blood vessel growth. ROP or retrolental fibroplasia is a significant cause of blindness in premature infants linked to abnormal retinal blood vessel development. So, early detection and treatment are essential to minimize the risk of vision loss. Retinal detachment is a serious eye condition where the retina separates from its underlying supportive layers. This separation can lead to significant vision loss and even blindness if not treated promptly. Stroke in the eyes. This is known as retinal artery or vein occlusion, and it occurs when blood flow into the retina is blocked, causing sudden vision loss in one eye. This blockage is often due to a blood clot or narrowed blood vessels, similar to a stroke in the brain, but specifically affecting the eye. Symptoms include sudden vision loss, blurry vision, or blind spots, and it's considered a medical emergency. An eye stroke or retinal artery or vein occlusion happens when blood flow to the retina is disrupted. As the retina relies on constant supply of oxygen-rich blood to function properly. When this blood flow is blocked, it can lead to a sudden loss of vision. Now we come to the conditions of the optic nerve. Glaucoma. Glaucoma is an eye disease in which the internal pressure in the eyes increases enough to damage the nerve fibers in the optic nerve and cause vision loss. The increase in pressure happens when the passages that normally allow fluid in the eyes to drain become clogged or blocked. The reasons that the passages become blocked are not known. The most common type of glaucoma develops gradually and painlessly without symptoms. A rarer type occurs rapidly, and its symptoms may include blurred vision, loss of sight vision, seeing colored rings around the eyes, and pain or redness in the eyes. Glaucoma cannot be prevented, but if diagnosed and treated early, it can be controlled. Vision loss to glaucoma cannot be restored. The treatment for glaucoma includes prescription eye drops and medicines to lower the pressure in the eyes. In some cases, laser treatment or surgery may also be effective in reducing pressure. Optic atrophy. The optic nerve carries images of what we see coded as electrical impulses from the retina to our brain. The optic nerve is like a cable uh, formed of more than a million tiny electrical wires or nerve fibers, each carrying a part of the visual information. If these nerve fibers become damaged, the brain does not get all the vision information and our sight becomes blurred. Optic atrophy means the loss of some or most of the nerve fibers in the optic nerve. Many diseases or disorders can lead to optic atrophy or damage to one or both the optic nerves. Optic atrophy can occur in people where the optic nerves did not develop properly. It may result from inflammation of the optic nerve or from glaucoma. Uh, in unusual cases, poisons, vitamin deficiencies, or tumors may also be responsible. Most commonly, optic atrophy simply occurs without a known or proven cause. The symptoms include blurred vision, abnormal side vision, abnormal color vision, poor constriction of the pupil in light, decreased brightness in one eye relative to the other. Amblyopia, which is also known as lazy eye, is a disorder of the visual system that is characterized by poor or indistinct vision in an eye that is otherwise physically normal or out of proportion to associated structural abnormalities. The problem is caused by either no transmission or poor transmission of the visual image to the brain for a sustained period of dysfunction or during early childhood. Amblyopia normally only affects one eye, but it is possible to be amblyopic in both eyes if both are similarly deprived of a good, clear visual image. Detecting the condition is in early childhood increases the chance of successful treatment, while the colloquialism lazy eye is frequently used to refer to amblyopia. The term is inaccurate because there is no laziness of either of the eyes or the amblyope uh, involved in the condition. The brain actually ignores the images from the weak eye and uses only those from the stronger eye, which leads to poor vision. It may be caused by strabismus also, in which the eyes look at two different points in space at the same time, sending two different images to the brain. Uh, we will read about strabismus soon. Now we come to the conditions of the conjunctiva. Conjunctivitis or pink eye. is redness and inflammation of the membranes, that is the conjunctiva, covering the whites of the eyes, and the membranes on the inner part of the eyelids. These membranes react to a wide range of bacteria, viruses, allergy provoking agents, irritants, and toxic agents, as well as to underlying diseases within the body. Viral and bacterial forms of conjunctivitis are common in childhood, but they can occur in people of any age. Overall, however, there are many causes of pink eye. These can be classified as either infectious or non-infectious. Pink eye may be caused either by viral infection or by bacterial infection. Xerophthalmia, the Greek term for dry eyes, is a medical condition in which the eye fails to produce tears. It's very common these days due to the extensive screen exposure that we have. So, it may be caused by the deficiency of vitamin A and is sometimes used to describe that lack, although there may be other causes. Xerophthalmia is a term that usually implies a destructive dryness of the conjunctival epithelium due to dietary deficiency of vitamin A rare condition, but still causing much damage in the eyes. So, other forms of dry eye are associated with aging, poor lid closure, scarring from previous injury, or autoimmune diseases such as rheumatoid arthritis, and these can all cause chronic conjunctivitis. Now, the conditions of the eye muscles. Binocular vision. Binocular vision is the ability to perceive a single unified image using both eyes simultaneously, which allows for depth perception and a three-dimensional view of the world. It involves the eyes working together to focus on the same object, with each eye providing a slightly different image to the brain, which then combines them. This process is also known as stereoscopic vision. What are the features? The features are simultaneous focus, that is, both eyes are directed to the same object, creating two separate images. Neural processing, the brain combines these slightly different images, a process called fusion, to create a single unified image with depth and distance information. Depth perception, this is the key benefit of binocular vision, allowing us to judge distances accurately and perceive the world in three dimensions. And binocular single vision, that is, the term emphasizes that both the eyes are working together to produce a single unified image. Um, Now we move on to strabismus or squint. This is a misalignment of the two eyes so that both the eyes are not looking in the same direction. This misalignment may be constant, being present throughout the day, or it may occur or appear sometimes, and the rest of the time the eyes may be straight. It is a common condition among children, and it may also occur in adults. A loss of coordination between the muscles of the two eyes leads to misalignment. This misalignment may be the same in all directions of gaze, and in some conditions, the misalignment may be more in one direction of the gaze. For example, in squint due to nerve palsy. Sometimes a refractive error, hyperopia, may lead to inward deviation of the eye. Poor vision in an eye because of some other disease like cataract, etc., may also cause the eye to deviate. When the eyes are not aligned properly, each eye is focusing on a different object and sends signal to the brain. These two different images reaching the brain lead to confusion. and may have either of the two effects. A child might ignore the image coming from the deviated eye and thus see only one image, but in the process he loses the depth perception. This suppression is of the image from the deviating eye results in poor development of vision in this eye, which is also known as amblyopia. And an adult can ignore the image from either eye and therefore has double vision. This can be very annoying and may interfere with work. As a symptom in a child, the parents may notice the deviation of eyes, and it's important to remember that the eyes of a newborn are rarely aligned at birth. Most established alignment at most established alignment at 3 to 4 weeks of age. So squint in any child who is more than 1 month old must be taken seriously, and adults may notice double vision or misalignment of the eyes as well. Nystagmus, this term means to nod. Okay, this is a term applied to rapid involuntary oscillatory movement of the eyes independent of the normal eye movements. They are usually horizontal, but vertical, rotatory, or mixed movements may also be seen. The condition is almost always present in both eyes simultaneously. The disorder may be present at birth, that is congenital nystagmus, or acquired later in life. This is acquired nystagmus. Congenital nystagmus is caused by albinism, absence of irises, optic nerve malformations, and congenital cataract if left unoperated within 6 months of birth. Acquired nystagmus is caused as secondary to visual loss or by toxin, alcohol intoxication, tranquilizers, sedatives, or brain tumor, head trauma, stroke, multiple sclerosis, brain hemorrhage, and Meniere's disease. The symptoms depend on the age of onset. These are classified into three categories. In congenital and early infantile nystagmus, the patient is totally unaware of the eye movements since the object being viewed uh, does not appear to move. To and fro movements of the eyes are noticed by the parents. If nystagmus is developed the childhood, after the child has developed fixation, there are characteristic nodding movements of the head depending on the type and the direction of nystagmus. In cases of acquired adult nystagmus, the objects and surroundings may appear to move. Okay, so now we move on to double vision. Double vision, also known as diplopia, is a condition where a person sees two images of a single object instead of one. This can occur in one or both eyes and may be side by side or above, below, or diagonal to each other. It can be a temporary issue or a sign of a more serious underlying condition. Symptoms include seeing double, whether side by side, above or below, diagonally, blurred vision or unclear vision in one or both the eyes, pain in the eyes or discomfort, headaches or dizziness, nausea and difficulty with balance or coordination, and it may be caused also due to damage in the nerves or muscles. Damage may be caused in the cranial nerves and uh, which are crucial for controlling the muscles that move the eyes, and damage to the nerves due to other conditions like diabetes, multiple sclerosis, or brain tumors may also occur. Or it may be caused due to muscle damage. That is, it may be caused by either nerve damage or muscle damage. Okay, so types of double vision include monocular diplopia and binocular diplopia. Monocular diplopia means double vision in one eye, even when the other eye is closed. This is often caused by issues within the eye itself, such as refractive errors or corneal problems or cataracts, and binocular diplopia. This is double vision when both eyes are open, which disappears when either eye is closed. This is typically caused by misalignment of the eyes, this is like strabismus, or problems with the eye muscles or the nerves. So, these are more or less all the conditions of the various eye diseases. Thank you.